You're watching 21st Century Conversations. Our conversation tonight, we're talking about the Affordable Care Act, implementing the Affordable Care Act in Connecticut. With me is State Senator Toni Harp. She's the, tell us again, Toni, your proper title and function.
I am Deputy President Pro Tem, and I co-chair the Appropriations Committee. I am the Senate Chair of the Appropriations Committee, and I also chair the Medicaid Oversight Advisory Council.
And when we say appropriations, we want people to know you handle the money. You're in charge of the money.
I'm in charge of the part of the money that we actually spend, not the money we collect.
Okay. So you're in charge of well, we need to know that. That's helpful. And Attorney Damien Fontanella is with the Office of the Healthcare Advocate. And tell us again briefly what it is that your office does mainly.
Our office educates the citizens of Connecticut concerning healthcare in general, their rights, what's available to them, reform, any questions. We advocate for them in instances of questions of denied coverage or inappropriate compliance with their plans, and we identify problem issues and trends and let our fine legislators know, so if there's any fixes that can be done, they do so.
Okay, now I want to summarize for you what we have covered so far and to recap for you the benefits of the Affordable Care Act. The number one thing is increasing access to affordable health care. And under that piece, they establish consumer assistance programs in the state, expand coverage for young adults, expand coverage for early retirees. They're rebuilding the primary care workforce, which is such a key piece because today it is very hard to find a primary care physician if you don't go to a major hospital. And allowing states to cover more people on Medicaid, and Senator Harp's talked a little about that piece. But these are, under the increasing access to the ACA, these are the key pieces that are being done. The next thing is they're improving quality and lowering costs. The Affordable Care Act allows consumers to get improved quality of care at a lower cost by linking payment to quality outcomes, by offering prescription drug discounts, by offering relief for 4 million seniors who hit the Medicare prescription donut hole, and that we can expand on a little more, telling people what that is. Providing free preventive care for seniors, such as colonoscopies and endoscopies, things that we can, that if you get screened and something's identified early, it prevents more serious and costly illnesses. And holding insurance companies accountable. Again, both Senator Harp and Attorney Fontanella explained that to us briefly, by addressing overpayments to big insurance companies, so they have to give the money back to the consumer, and strengthening Medicare Advantage. We're going to talk a little bit about that, Senator Harp. Prohibit denying coverage of children based on pre-existing conditions. Regulating annual limits on insurance coverage and bringing down the cost of healthcare premiums. So those are some of the key things that the Affordable Care Act does. Now, please, either of you explain to me, we hear a lot about the donut hole. We know that it is this sum of money that usually is not covered by Medicare. It's over $5,000, we knew before, that once you get to a certain amount of coverage, you have to pay this money out of pocket, whether you have an income or any way to pay it or not, or you don't use services, and many people end up being more sick and incurring greater expense to the system because, they didn't have the $5,000 or whatever money it was. Explain to us how the ACA helps with that.
Well, the donut hole you explained, as it is right now, you explained very well. I mean, there is initial coverage with cost sharing, co-pays, percentages, depending upon the plan. We're all familiar with co-pays, unfortunately, or fortunately, depending how you look at it. But once you hit a certain limit, I forget exactly what, it's around $2,400, I think, there is no coverage. That's the hole.
Yes.
But once you, I think it's an additional, remember what it is? It's around $3,000. Once you've incurred an additional $3,000 plus in prescription costs, then the coverage would pick up again. But you have to get past that hole.
Yes.
And if you have medication expenses which are substantial enough, and anyone who's looked at their prescription when you pick it up at the pharmacy, you know that they're pretty substantial.
Yes.
That adds up to, you know, probably $200 to $300 extra a month just to keep your insurance. That's on top of your normal premiums. So even in the donut hole, when there's no coverage, you still have to pay the premiums for that plan. The ACA is going to eliminate that. It's going to scale back the cost sharing, and by 2020, I believe it's 2020, it's going to be eliminated.
Eliminated completely. So it'll be eliminated gradually until it goes away completely.
Completely.
Okay. Now, we know that there are a number of problems in the healthcare system now, and I was really pleased to see how your agency is helping. And I want to, I'm asking you to tell us a little more about how do people access the Office of the Healthcare Advocate? How do we access your services? And what type of things, except for, you know, someone gets a claim that they think this unjustified, what are the key things that you deal with?
Almost anything related to healthcare. We're easy to access. We're on the web. You can email questions and complaints, concerns in. You can call an 866 number to access us.
Oh, yes. Let me give your number.
Direct emails to staff.
The person in charge of the office is Victoria Veltri. She's a state healthcare advocate, and they're in Hartford. The toll-free number is 1-866-HMO-4446, and the website is there, the www.ct.gov/OHA. There's also an email address for healthcare.advocate@ct.gov. Now, your office recovered $2.4 million in healthcare consumer costs for the second quarter of 2012. That's just one quarter.
That's just one quarter. Yep.
And what's the process? You know, when something happens and someone is uncomfortable, many of our consumers not only don't know how to access or how to challenge something when a big hospital or big organization sends them a bill, but they might not always have the wherewithal to write a letter explaining what the complaint is and what the issue is. What would you say to those people? How can they access your services? Besides, what kind of intake process do you have, in other words?
So, if a consumer has a concern or a question or something they're not sure about, particularly related to healthcare,
yes.
I encourage them to call our office and ask. Call, leave a message if no one picks up, which someone usually does, and if they don't, we're on the phone or not there. Email, we pick up. It is assigned to a case manager that is appropriate for that, has expertise in that particular field, and we have case managers with varying degrees of expertise, with areas of focus. It doesn't matter what the question is. If it's something that we are appropriate to pursue, we will zealously advocate for it. If it's something that's basic education, we will make sure that the person has the questions answered, and we strive to make sure that it's done in a way that next time they're faced with it, it won't be so mystifying.
Yes.
Because the letters, if you've ever received a denial letter from an insurance company, it's very difficult to understand why it's been denied, what they're actually referring to.
And this is particularly true for mental health issues.
Mental health is one of our most problematic areas of denial.
Of course, when someone already has a mental health issue, it's probably more difficult for that person to always understand what is happening and understand the denial letter. So again, we want to say to people, if you cannot do it yourself, ask someone, ask a relative, a friend, a neighbor to make the call for you. Again, the number is on your screen for the Office of the Healthcare Advocate. Call that number. Tell the person who answers the phone, give them your number where you are, give them your address, tell them that you have a claim that you want to challenge. But again, reach out for the help you need, because this office is there to help you.